I couldn't imagine having Golden anywhere else but Texas Health Dallas. Hi, my name is Ashley Harris. I'm the proud mother of Golden Johnson. I chose Texas Health Dallas to have my baby because of the level of care they provide. And also, I just really wanted to have it at a hospital that I was familiar with as well. So my original birth plan was to have a normal delivery. It wasn't actually until about 2 to 3 weeks prior to have Golden that Dr. Crable notified me I would be having a C-section. So ultimately, that was the end goal, was to have the C-section. Leading up to that, I started to feel a little strange. I started to feel some sharp pains, but then the pain intensified. So I was like, something isn't quite right. And I remember Dr. Crable saying, if something feels off or you just don't feel normal, make sure you go to the emergency room.
So she just keeps talking about her stomach's hurting. She kept kind of like complaining about her pain and stuff. So I was like, maybe we should just go to the hospital. So we ended up rushing to the hospital. We got there. And I really thought it was kind of like mild. I didn't think it was anything serious. But she was kind of having contractions and she wasn't used to them. So it wasn't until we got in the hospital and they were, all these nurses started coming in. And it was just like everybody just running back and forth. It was like 10 nurses in the room. And that's when they were saying that they couldn't hear the baby's pulse.
I'm Dr. Laura Rosenfield. I'm an obstetrician gynecologist at Texas Health Presbyterian Hospital of Dallas. At about midnight, little after midnight, I get a phone call. And it was Ashley in triage that they were worried about, that needed some care. They said they were having trouble monitoring the baby. She'd come in some pain. So there were some concerns right off the bat. I'm 6 minutes from the hospital. So they were gonna try to get ready and get everything going, but they had to have a doctor in the room ready to go. The nurses and the anesthesiologist were very quick in getting her ready. So when I walked in the door, I immediately walked to the OR, get all scrubbed up and ready to go, and they've got her back there, but she's still not asleep yet.
Things were kind of a blur for me as I started to kind of throw up, and things went really fast. So they decided to put me under, and I wasn't sure what was going on. There was one nurse, she was like, just look at me, just focus on me, look at my eyes. And she helped me through the entire thing because I was so panicked.
I think I sat in that room for about an hour and 30 minutes, just not knowing anything. There's so many things going through my head, I didn't know what was going on.
When I finally got into the abdomen and I didn't immediately see the baby, I said, where's the baby? And then I was able to, take a breath, put both hands in, and find the baby at the top of the diaphragm where it's not supposed to be, right up here, right underneath her ribs at the top there. So we figured out why she was having all of those problems at that time.
It wasn't until I actually woke up that I discovered my uterus ruptured and Golden was in my abdomen. So he had found a little hole and traveled to my abdomen, which basically, explains all of the pain, the vomiting, all of that. So they told me it was sure of a miracle that, he was alive and that I was doing fine. Because normally in those circumstances, things don't really pan out that way.
Thank you, Texas Health Dallas, for giving my son a future.
Golden is nothing short of a miracle.